Hey everyone, it's Dr. Rick, founder of Herbal411.com. Today we're going to talk about this thing called the vibration plate. That's why my camera is off angle. As we get older, there are a few things that will enter into our lives. One will be the increased risk of cancer. The other will be some form of cardiovascular disease like heart attack or stroke. Third is dementia or some form of neurodegenerative disorder. But if you drop down to the fifth leading cause of death, it's falls, meaning falling down. And you would think, why would a fall equal or come close to a heart attack, cancer, or stroke? And it's because once you lose mobility, you lose independence. And with that, there's other downstream issues that happen after the fall, like immobilization, dependence on other people to feed you, the development of pain, and maybe even post-operative complications from the surgery to fix your hip or to inject your back with cement. Like with any disease process, if you're empowered to know what's coming, you will hopefully be motivated to prevent it. But unfortunately, the way the American health system works, you do not get to screen for osteopenia, mild thinning, or osteoporosis, fracture potential, until you're older, and by that time it's already started. I did do a video which I'll link down below for osteoporosis, strontium, vitamin D, and a couple other things, but I wanted to reiterate the information I presented last time and specifically bring up this study which talked about vibration plates. For my patients, I always have to have data to drive direction and lifestyle change. So like me, a lot of you want to live and enjoy retirement. But even if you're not interested in becoming a 100-year-old centenarian, it's important to understand that the same things that you do to get to 100 will also prevent you from having disease and suffering in your 60s and 70s. So let me give you an example. If you're in your 50s and you have 3 diseases, like high blood pressure, high cholesterol, and elevated glucose, if you don't make any lifestyle changes in your 50s and you just take the medicines your doctor gives you because the blood tests reverse back to normal, the likelihood is that in your 60s, more disease is coming or those 3 initial problems will advance. And what does a treatment entail with that? More medicines, higher doses, and more suffering. So going back to osteopenia, osteoporosis, and the number 5 cause of death in the US, there's a couple of actionable lifestyle changes that you can implement. Number 1 is having some form of impact. And what do I mean by impact? Just think about jumping. You have jumping rope, you have jumping jacks, and you have skipping. Now, if you're that weak that you can't really skip anymore, that's already a bad sign. But have no fear, if you're one of my patients, I'll send you to a physical therapist first to take care of weak knees, bad hips, bad back, or a foot doctor for painful feet. And once we bolster those weaknesses, then we can start impacting life, so that if you do fall, you'll survive the fall and you won't break anything. If you have a history of osteoporosis in your family, or if you're short stature and thin, typically people with low BMIs will have higher rates of osteoporosis and osteopenia, especially if you're female. This video is for my patients who are beginners who haven't really exercised in a long time and just don't know which way to go. Bottom line is you have to do something. And even if you're not a sloth where you're just watching TV, eating chips, and sitting on a couch, if you do a lot of chores around the house, I think that's good, but you have to have some kind of stimulus that causes impact. When your skeletal system senses that there's impact somewhere, like walking or jumping or jogging or CrossFit, then there's little guys called osteoblasts that lay down more matrix. Think of bone matrix as cement. The more impact signal you give to your bones and joints, the more cement is deposited, and the farther back you postpone the osteoporotic fracture. The reason I wanted to show you this vibration plate is that if you don't really exercise, or if you just do a little bit of walking and you've found that you're osteoporotic already, then whatever you were doing as far as exercise before the DEXA scan was done is probably not good enough. Don't stop what you're doing, but add on to it. And I think the data that was shown in Benedetti and Morrow's study embraces the fact if you just stand on a vibration plate for up to 30 minutes a day for close to 2 years, it will work to thicken your bone. I usually tell my patients that you can find these things online and they can range from $150 to $300. But if you're in Chicago and you're isolated at home, you don't like going to the gym, you're still in physical therapy once or twice a week to take care of your weaknesses, this would be a great adjunct just to stand on it. And if we're going to try to postpone the destiny of you having an osteoporotic fracture, I would use the data available and try to develop a personal plan that would give you success. And I think 15 minutes a day while you're watching Netflix or reading a book or getting ready for bed can impact your success. And based on the studies of going up to 22 months, you would think it's going to be boring, but you don't have to just do this. This will be your break-in until you find your way with your team to have some form of multi-component training, which does bring me to the second point. Even if you do have some form of impact or vibration, I would always want you to work on muscle growth. I don't want you to end up looking like a bodybuilder, but honestly, it takes decades before that happens. And don't fool yourself. If you work out 3 months, it's not like you're going to blow up. I think if you just have the intention to move and you dedicate some form of regular ritualistic exercise, you'll reap the benefits as far as feeling better, and that will support you to go even further. Again, I honor my patients who have dedicated some form of exercise in their lifestyle, but if the DEXA scan, which is the bone scan used for determining osteoporosis, says that you're thin, then everything you've done in the decades before the bone scan is probably lacking a bit. So the idea is add on. Experiment with certain classes that you can buy at your park district, or just be open to other things that seem to be novel in your area to give it a try. And in September of 2022, I've targeted Zion National Park as our destination. And it's not just a goal to have a bucket list visit somewhere at a national park. It's also meant as a little bit of a carrot so that people will start to accumulate more and more exercise to get to goal. If you can find your own motivation, that's fair. My feeling is that if you're not accountable to anybody or don't have a goal, sometimes other things get in the way to say, okay, I'm not going to exercise today. So just to put in a personal plug, if you're interested in hiking or at least going out to nature therapy, check out Dr. Rick Hiking Excursions on Facebook, or go to herbal411.com and sign up at Dr. Rick Hiking Excursions to be emailed on the schedule for hiking this summer. Going out hiking in the summer does give you sun exposure. I do not believe that in Chicago, sun exposure is good enough for vitamin D. And all the data, whether it's immune system in fighting COVID or just trying to beat osteoporosis, says that maximizing on your vitamin D level to what I like to be 70 will help you slow down and maybe reverse your osteoporosis osteopenia. You can certainly take the medicines that your rheumatologist or your primary care doctor offers, especially if you're in a bad way or very severe. But I would always say implement everything that we've talked about as far as your lifestyle change, for fear that if you just rely on medicines, your disease will progress. And whether this is a continuation or the start of your journey, empower yourself to control as many variables as possible to have the best outcome. Check out the video I did on strontium and osteoporosis. And thank you for watching up until this point in time. Please share this with other people who are going through osteopenia, osteoporosis, or making a decision whether they should get on or off their medicines. And don't forget to like and subscribe. See you at the next video.